I want to talk about, I mean, she talked a little bit about pressure on the NHS there, and there's huge pressure on the NHS because 7.7 million people, almost, very close to that figure, are on waiting lists, waiting for routine treatment. Shazia Malik is a consultant obstetrician and gynaecologist and joins me now. Shazia, thanks for joining me this morning. It just goes up and up, doesn't it, these waiting lists? How much of it is to do with the government? How much of it to do with doctors striking? Because that's part of it too, isn't it?
Yeah, actually very little is to do with doctor strikes. So the Nuffield Trust, who are independent, have looked at the figures. They've published it publicly. And well over 7 million people were waiting on waiting lists by Christmas last year. And the strikes have only been happening, as far as doctors are concerned, since April this year. I think we need to remember that nurses have been on strike, ambulance workers have been on strike. And even during those strikes, many doctors have continued to work. They've done their clinics, they've done urgent operating lists. So in fact, the figures, if you look at the Nuffield Trust figures, the addition because of the strikes is minuscule.
It's still in the tens of thousands. I mean, I totally take your point, Shazia, and I know you're factually correct, but what I'm saying is that Labour earlier this week, Wes Streeting, the Shadow Health Secretary, did a Freedom of Information request into this. And listen, it is a tiny proportion, as you say, but there's still tens of thousands of, I mean, literally 36,000, I think, was the number of missed appointments that were happening because of the doctor strikes. All I'm saying, whether you agree or disagree with the doctor strikes, they're not helping this situation because appointments are being missed. But there is clearly a much bigger issue in all of this as well.
Yes, so, I mean, the issue is actually staggeringly awful already. So 36,000 appointments, some of which would have been missed anyway. So if you've ever sat in an NHS clinic, there will be a full list of patients. And increasingly, certainly when I was doing these clinics, is that, you know, a third of the patients may not even turn up.
Yeah.
So they have taken an appointment from somebody who perhaps would have valued it a little bit more. And sometimes it's not always the patient, but in fact, the admin system in the NHS is also crumbling. So people get sent duplicate appointments. They get appointments for a day that they were not meant to be in clinic. So when we talk about these figures, it's really not helpful, excuse me, to patients to look at things in isolation. It's actually the whole NHS as a system.
And it is that systematic failure, isn't it, Shazia? It's not it's not just about money. Money is part of it, but it's not the only thing. So what can be done? I mean, we're not going to get to the bottom of this in a sort of 5-minute interview, but in terms of how the NHS can be reformed, when it was set up in 1948, Britain was a very, very different country to the one it is now in 2023. Is universal healthcare free at the point of need? Is that system the right system?
Yes, it is. And I think this country should really hold on to that. And a lot of people cannot afford, especially with the current cost of living crisis, to add another additional cost to their daily living. And healthcare is one thing this country is a shining beacon, is free at the point of healthcare, is something we have to grab onto. I think at some point, someone is going to have to accept that the NHS as an organisation needs, rather than little bits of it being looked at, one has to look at the whole system. I mean, if you look at, and I'm speaking as somebody who has been working for 30 years now, if you look at how many billions have been spent on management consultants over the time that I've been practicing as a doctor, and very little has improved, it's very clear that we need to take a top-down look at this. I mean, I'm speaking now as a doctor, but I have to tell you, on the ground, the divide between management and the people actually providing care to patients is quite large, and sometimes they have different interests and different targets. So the government I think nurses, midwives, doctors need to be listened to. If we spent less time on managers clicking tick boxes and walking around the hospital, and more in asking patients and clinicians what is needed, we could have a much better healthcare system.
Yeah, I think a lot of people will agree with a lot of what you're talking about there. Shazia, thank you very much indeed. Shazia Malik, consultant obstetrician and gynaecologist.